In this video, here's what we'll cover: what work-related stress really is, the job demand control model, and why not everyone burns out. When stress becomes burnout, what actually helps? From basics to therapy. When work stress becomes a psychological injury, most weeks, at about 7 o'clock on a Sunday evening, something quietly shifts. The shoulders creep up towards the ears, the chest tightens, the mind starts scrolling through the emails still sitting unanswered. The meeting on Tuesday, the conversation with the manager you have been putting off for a fortnight. You are not imagining it, and you are not being dramatic. That is your nervous system getting ready for the week ahead, and often, it is trying to tell you something honest about the fit between you and your work. Let me start with what work-related stress actually is, because it is more than having one busy week. It is a physical and mental response to demands at work that outstrip the resources you have to meet them, whether that is time, control, support, or skill. In the short term, that response is completely normal and often useful. A deadline sharpens your focus. The stress response is meant to rise. The trouble is that it is also meant to come back down again, and sometimes the recovery never arrives. When the stress response stays switched on for months, it slowly wears the body down. Researchers call this allostatic load. Over time it can show up as broken sleep, muscle tension, gut trouble, a weaker immune system, and a higher risk of anxiety and depression. On their own, a few rough weeks mean very little. Together, week after week, they are your body asking for a change. That brings me to one of the most useful ideas in workplace psychology: the job demand control model. It was developed in the late 1970s, and it explains something I see all the time. Two people can sit in the same demanding role and end up in very different places. And the difference usually is not personality, it is control. Picture two dials. One is demand, your workload, your time pressure, the emotional weight of the job. The other is control, how much say you have over the way the work actually gets done. The hardest place to sit is high demand paired with low control. That combination is linked to the worst outcomes for anxiety, low mood, and even heart health. Later research added a third dial, social support, and found that good support at work softens the blow, even when control is limited. So the honest question is not only, am I coping? It is also, am I in a high-strain role? And what here can actually change? Sometimes the answer sits with us, in skills and boundaries. Often it sits at least partly with the job itself. When high strain runs on unchecked, it can tip into burnout. The World Health Organization now describes burnout as an occupational syndrome, a genuine phenomenon that grows out of chronic workplace stress that has not been successfully managed. It has three features. First, exhaustion, being physically, emotionally, and mentally drained. Second, mental distance from the job, a slide into cynicism and just going through the motions. Third, a nagging sense of not doing well, even when your actual work is perfectly fine. I find it helps to remember what the research shows. Burnout is not a personal failing. It is best understood as a mismatch between a person and their work across 6 areas: workload, control, reward, community, fairness, and values. When that mismatch is big enough, for long enough, burnout follows. This is not weakness. It is a poor fit left to run too long. So what actually helps? It depends on where you are. For early stress, the strongest evidence sits with the least dramatic steps: protecting your sleep, moving your body most days, having an honest conversation at work, and easing the load where you can. One very large review found that regular exercise eases anxiety and low mood, with effects that rival some medications. For moderate stress and early burnout, self-guided digital tools built on CBT have become a genuinely useful option. A recent trial of one such app found small to moderate improvements in stress, anxiety, and burnout over a few months, and those gains grew a little further over time. These are real, not miraculous, and they make a sensible, low-effort first step. For stress that is more entrenched or severe, individual therapy remains the standard. That might be CBT, which shifts the thoughts and habits that keep stress going, or ACT, which builds the flexibility to meet hard realities without being swallowed by them. It might be behavioral activation for the low mood that often tags along, or EMDR, whether stress carries trauma. Sometimes medication has a place too. And that is a conversation to have with your GP. Finally, sometimes work-related stress crosses a line and becomes a psychological injury, an anxiety disorder, depression, or PTSD that work has clearly caused or made worse. In New South Wales, that can be claimed through work cover. A claim is not about blame or complaint. It is a formal recognition that work contributed to a diagnosable condition, so that assessment, treatment, and return to work support can be funded. It usually begins with your GP, who provides a certificate of capacity, and is supported by a clinical psychology assessment. If that Sunday night feeling has quietly become the whole week, please know that support is available, and that early help tends to work best. In my practice at Potentialz Unlimited in Bella Vista, I work with people across the Hills District on work-related stress, burnout, and psychological injury. You can read the full guide, or book an appointment, using the links in the description below. And if things ever feel unsafe, please reach out straight away to Lifeline on 13 11 14. Before you go, here's a quick recap of what we covered. What work-related stress really is, the job demand control model, and why not everyone burns out. When stress becomes burnout, what actually helps, from basics to therapy. When work stress becomes a psychological injury,